Dr. Robert Adams from the Adams Chiropractic and Neurology Group in Sonoma, California. I'm going to take a minute here and talk about low back pain. Normally, the low back has a certain way it's supposed to function. This is an example of a spinal model. So there is a spinal model. When the spine tilts to the left, the vertebra should tilt to the left and also rotate to the left. When it goes to the right, it should tilt to the right and then rotate with the spinous is rotating around to the right side. That's a coupled motion in the low back area. That coupling motion is accomplished by the individual muscles that go between the vertebrae. Those muscles have a job to do. They're supposed to stabilize the spine, and also they move the spine. If the spine doesn't move properly, since the half-life of muscle protein is 6 to 10 days, if these joints don't move properly, these muscles are going to get weak and they're going to begin to atrophy, and then they're not going to stabilize the spine properly. To illustrate this aspect, we can do an MRI evaluation. And the MRI of the spine, this shows in this upper left corner here, it shows the healthy back, and you can see right here, these are the paraspinal muscles. Looks like a steak, if you will. Okay, this would be the spine if you touch somebody's back right here. This is the body of the vertebra. This is where the nerve roots go down the middle. See how healthy this back is? There's very little fat in there. But see, as the spine begins to deteriorate, see a little more fat or marbling, then an increasing amount down low here, and then a significantly atrophied back over here. This is not what you want. This is why, for example, with respect to food, meat, this marbling is where the fat is in the meat that we would eat. And in humans that have atrophy of the back, they would have marbling. That's a fat back. We do not want that fatty infiltration. And so these are joints, example of joints that haven't moved properly over time. There's an emphasis, unfortunately, with backs to just talk about the disc. And the disc is the front of the vertebra, between the vertebra. It's a shock absorber. But the joint complex is the disc in the front, and then two joints on each side, a facet on each side relative to the spine. So it's three areas working together. Unfortunately, what happens if the back muscles become weak, they allow the spine to move inappropriately, and it shifts the weight or burden onto the disc in the front, causing the disc to deteriorate. Now, if the disc goes too far, it may herniate, rupture, and cause significant damage to the nerve roots. And if it goes too far, surgery may be necessary or may be the only solution. Our goal is to find these problems before they become surgical conditions. Once we determine an area that doesn't move properly, we make specific adjustments to restore the motion, restoring the feedback from that area, allowing the muscles to get stronger, which allows more stability of the posterior elements of the joint, which then will offload the shock absorber disc. So if we think about the back of the joints being like this part and then the disc in the front, the more stable the back is, the less breakdown on the disc. The weaker the back muscles, the more the weight's going to shift on the front of the disc, causing the disc to be pulverized and ultimately completely eradicated or eliminated. So we want to keep the posterior elements healthy. And in proper rehabilitation, that's where adjustments are important for stimulating joint movements and exercises for strengthening the muscles for the appropriate feedback. Now, if, for example, those muscles get weak over time, they can build up lactic acid. Now, the muscles we're talking about are illustrated in this, text here. And those paraspinal muscles of the back, if we look at the back this way, and we peel that layer away, we go here. Now look at how these muscles go from the low back all the way up. We peel this layer away, we go here. Look at this muscle, comes from down low all the way up to the neck, up here. So these muscles are engaged from down below all the way to the top. Peel that layer away, we go here. So nature doesn't say neck, upper back, or lower back. And treating low back pain without appropriately addressing the areas up above it is ignorance. Because it's imperative that one realize that what happens above this low back will integrate and affect significantly what happens down below. These deep paraspinal muscles allow for that coupling movement we talked about. Well, if these muscles build up lactic acid or other things as a consequence to their weakness, then you're going to have a pain referral which may go down into the legs. And so Bernard Feinstein and his group, in a paper entitled Experiments on Pain, referred from deep somatic tissues, published in the Journal of Bone and Joint Surgery in 1954. they demonstrated that injecting a salt solution into those deep paraspinal muscles would actually provoke pain, which would go down the leg. So for example, this would be a healthy young person that they stuck a salt solution in at the S2 level. See how it goes down? Let's look a little bit more here. Let's go walk down through the lumbar spine. So here we have L3. Pain shoots down that. Some of you may have that kind of pain that goes down the outside of your leg, or down the front of your leg, or down out in the hip area. Sometimes individuals have pain referring into their groin area. Fortunately, I had a patient one time who sadly had a hysterectomy as a consequence to pain that she was having down in her abdomen, which really had nothing to do with it. Her uterus she still had pain after the uterus was removed because it was referred from her back. And later an adjustment corrected that. So referred pain can mimic internal organ problems. You see this pain down the back of the leg here, down the side of the leg from the L5 area. Unfortunately, many individuals have pain radiating down their leg, and they happen to simultaneously be having some type of a disc herniation, as demonstrated in MRI, and they'll have an operation, which doesn't really correct their problem because the pain was referred from the back muscles that were agitated as a consequence to the weakness of the paraspinal muscles. So before we contemplate surgery, we want to make sure that there's evidence that there's true nerve root compression, and those would be a lack of reflex activity, atrophy of the muscles in the extremity, maybe loss of pinprick and vibration. But simply having pain radiating down the leg is not a criteria for an operation. These were healthy individuals that simply had a salt solution injected into their back. Now you may not have salt in your back, but as a consequence to poor motion over time, you've got atrophy of those paraspinal muscles, and they're not able to stabilize your back properly, so a little bit of activity, lactic acid builds up, which activates pain, much like the salt would deep inside. So we evaluate aberrancies of coupled movement by palpating with our hands how the spine is moving, but also taking side bending x-rays. If you look carefully on these side bending x-rays, they illustrate that the joint's not moving properly. You can see the vertebra doesn't tilt and rotate in this direction and doesn't tilt appropriately on this side. So once we identify the area of the spine that's not moving properly, then we begin a procedural, various spinal adjustment procedures and exercise rehabilitative activities. Exercise activity can, of course, incur cross-crawl exercises, neck extension, low back extension, side bending exercises, also cross extension exercises. We use a whole gamut. We also use a spine force piece of equipment which allows the spine to be tested and also strengthened. We may also use a series of home exercises with exercise TheraBands and exercise balls. But the key components are specific adjustments for motion, exercises for strength and reinforcement.